Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Thank you for making the effort of being here today. It's really good to see you all. You know, this is the first step in participating in your own health care, and that's important because the doctor is only half the equation. So educating yourself will help you live a happier and healthier life. What I'd like to start with is a film. It's a short film, and then we'll open it up to any questions and go on from there.
Our feet. Every day, they get us where we need to go. They keep us moving, on the go, able to do things we need to do, and things we want to do. But sometimes we forget to take care of them. And if we have diabetes, that can mean problems, even serious problems. If you or someone you love has diabetes, you know that with good care, you can enjoy a full, active life. As we will see, taking care of your feet is especially important when you have diabetes. Your doctor's plan of care may include a good diet and an exercise program like walking or bicycling to control your weight, regular checkups by your doctor, and following your personal treatment plan to help you keep your blood sugar at a good level. But why is foot care so important for a person with diabetes? Well, diabetes makes it harder for your body to keep your feet healthy. Our feet, like the rest of our bodies, need to get a regular supply of food and energy. Our blood is the transportation system that carries food and energy to all our body parts, all the way down to the ends of our toes. It's a round-trip system that also takes away anything the body cannot use. When we have a good system of circulation to and from our feet, cuts and sores get better. But if you have diabetes, the arteries can narrow and harden so your circulation is not good. This is called atherosclerosis, and it can be accelerated by diabetes. Then, less food and fuel can get to your feet. Poor circulation also makes it harder for the blood to take away what the body cannot use. Smoking makes this problem even worse because it promotes the process of hardening of the arteries. For the person with diabetes, this means that cuts, sores, and wounds are more likely to become infected and that they'll heal very slowly. Diabetes also causes nerve damage, which can mean a loss of feeling. Less feeling in your feet can mean cuts and sores can't be felt. It can also make it hard to feel the difference between hot and cold. A small hurt or constant pressure on a foot can lead to a very serious problem over time. For the person with diabetes who can't feel as well, that problem can result in a tragic loss. The person with diabetes must watch his feet. Sore and cracked feet are calling for help. A few simple steps of foot care every day can make a big difference for that person with diabetes and his family. Let's quickly walk through 5 steps of foot care that are easy to remember. They can help you keep your feet healthier and happier. We'll call them the 5 C's. Let's begin with step 1. Clean and check your feet every day. Wash your feet carefully with soap and warm water, not hot water. Hot water can burn your feet. Use a soft brush or washcloth. Don't soak your feet because it may dry them and cause the skin to crack. Soaking could also cause your feet to swell. Don't rub your feet or be rough on them. Pat dry. Be sure to dry between your toes. Now, check both of your feet every day for blisters, scratches, reddened areas, corns, or calluses. Any problems. If you can't see the bottom of your feet, put a mirror on the floor and hold your foot over it. If you still can't see the bottom of your feet, ask someone else to look at them for you. Don't ignore your feet, even if you have poor eyesight or arthritic joints. Wear your glasses if you need them. Use good light so you can see. Step 2, condition your feet. Condition and lubricate dry skin with a cream, petroleum jelly, or a lotion without any perfume or alcohol. Don't put any moisturizer between your toes, though. That skin needs to be kept dry. Step 3, care for your feet in the right way. File or clip your toenails straight across with a slight curve at each corner. And don't cut the nail back too far, because that can cause ingrown toenails. Don't round the corners too much or cut them too close. And no poking around your cuticles. They help protect your nails. If you have a corn or callus, don't try to remove it. Let your doctor or foot doctor take care of it for you correctly. Step 4, always protect your feet by keeping them covered. Here's why. A loss of feeling in the foot of a person with diabetes can mean that he or she could step on a tack or piece of glass without even knowing it. So, just to be safe, it's best to always wear shoes, sneakers, or slippers, depending on where you are and what you're doing. Inspect and check shoes first to make sure nothing has fallen inside that could irritate your feet. And when you buy shoes, always have them fitted carefully so they're not too tight and don't rub. Remember, it's best to buy shoes at the end of the day to allow for the natural swelling of your feet. Blisters, calluses, corns, and sores can come from shoes that don't fit right or from new shoes that you've tried to break in too quickly. Avoid shoes with pointed toes, high heels, and straps that bind. It's better to choose a low-heeled, lace-up shoe with a toe area that won't pinch or squeeze the toes. Tough soles give good support and protection. Well-made leather or cloth sneakers are a good choice because these materials let the skin breathe. Velcro can help for easy fastening. It's best to wear cotton socks so your feet can breathe. White socks are best because they don't have colored dyes that can rub off on your feet. And remember, never wear garters or socks with tight bands at the top because they can cut off the blood supply to your feet. Never use hot packs or a heating pad on your feet because you could burn your skin if your feet have lost any sense of feeling or sensation of hot and cold. Step 5, use caution and call. If you have diabetes, you can never be too careful with your feet. Protect them from accidents and injury. Be careful walking on slippery floors and streets. Walk in good lighting, especially on stairs. Call your doctor if you have any pain, swelling, change in color or temperature, lack of feeling, or soreness in your feet or legs. Remember, a small sore can get worse fast. Now, let's review our 5 C's with some simple do's and don'ts for foot care. Don't soak your feet or scrub them too hard. Do clean and check your feet carefully and gently every day. Don't use drying medicines like iodine, rubbing alcohol, or medicated corn pads on your feet. Do moisturize your feet every day. Don't try to remove corns, calluses, or ingrown toenails yourself. Do keep your toenails trimmed properly using clean toenail clippers. Don't go barefoot, ever. Do wear shoes that fit right with tough soles and rounded toes. And check inside before putting them on. Don't wear garters or tight socks. Do wear loose, white cotton socks. Don't ignore any problems or changes in your legs and feet. Do call your foot doctor or healthcare professional for help with foot problems. They can help you keep your feet healthy, to keep them working for you.
Oh, generally speaking, I prefer lace-up shoes. I did bring some shoes. They're out back, I should say. But Velcro is okay. That's all right as long as you're measuring. They're measuring your foot in the afternoon, late afternoon. But lace-ups do have the advantage of accommodating swollen feet. The more laces, the more eyelets you have, the better. I prefer 5 or 6 eyelets. A lot of the athletic shoes were perfect. And before diabetic shoes came on board, that's what I would refer my patients to. For example, a New Balance or a Nike, they're all fine shoes, and they do accommodate feet very well. They also accommodate orthotics, which are arch supports, which we fabricate in special situations. And that's something that was not mentioned in the video, and that is that there are other things that we can do to help accommodate feet and to relieve pain, such as the use of special shoes, braces, arch supports. The 5 steps to foot care, they mentioned not to soak your feet. Well, because it leaches out the natural oils in your skin. Some diabetics tend to run a little bit dry, and if anything, you need to hydrate your skin with a lanolin-based lotion. So there are lots of them on the market, and I like whatever works, basically. Cetaphil seems to work quite well, but there's Eucerin, any number of, yes, sir?
Can we use Vaseline, regular Vaseline?
Like in Vaseline intensive care or oily Vaseline? The intensive care or the Vaseline petroleum jelly? Is that the one you're referring to? I think on cracked skin, like on the heels, that's a great product. Yeah, it's very good. I would use that on the heels. I would avoid it between the toes, though. You never want to put anything between the toes. And the reason is that will macerate the tissue, and that will crack, eventually provide a portal of entry for bacteria and then infection. So you want to avoid putting anything between the toes. Okay. Also dry. You need to dry between the toes when you shower or bathe. Make sure, don't take a piece of gauze or a towel and move it back and forth. Just simply blot the area. Make sure that that area is dry. Okay. What else? Condition your feet with any hydrating lotion would be fine. Cut your nails straight across. You know, it's probably best to have a podiatry consult first to establish the level of care. You may be at the beginning of your diabetes without any circulatory problems, without any neurological problems, and that's fine. But it's always a good idea to have a baseline exam. That means see your podiatrist. There are about 10 of us here in Fremont. And get an exam, know where you are with your diabetes, and then you go from there. We will evaluate your circulation and your nerve supply. Those are the 2 areas that we're concerned with. Now, you may have heard of the term neuropathy. That's a condition by which you lose your sensation over time. And it's so slow, you're not aware of it. You know, you may not feel the callus, you may not feel the corn, or the ingrown toenail for that matter, until you see the blood on the sock or the nylon. So we want to try to avoid that. That's the whole purpose of a baseline exam, just to make sure that there's no false sense of security on your part, meaning, well, it doesn't hurt, so it must be okay. And that's what we don't want. We don't want that situation. Often by the time they get to my office, they're already in a situation where, a more critical situation. Yes?
Oh, I'm assuming that sandals you should definitely stay away from, right?
Sandals are okay.
Can you wear them with stockings?
With nylons or with stockings. You can wear them with stockings, sure. You wouldn't want to go barefooted, but certainly sandals.
Sandals.
Slip-ons, yes, to get around. But if you had neuropathy and you stepped on something in your home, you may not feel it. That's the problem with going barefooted. So sandals would be fine. Anything with a rubber sole would be all right.
What about, I see a lot of people wearing those flip-flops.
Flip-flops are, they're not very supportive, but if you're just lounging around, it's okay. You know, if you're outside, it's a hot day, you may not feel the sun. That's the problem with the loss of sensation. Some folks sustain a 2nd-degree burn and they're not even aware of it. It doesn't hurt. So, common sense. Don't walk on the pavement if it's on a hot day, you know, without shoes or sandals or flip-flops. Don't use a heating pad. Don't set it to high, that's for sure. A lot of folks set it up because they can't feel it. It's not warm enough, so they turn it up. And it's just right, but it's actually too hot. The question was, how do you avoid ingrown toenails? Cut your nails straight across. Before you do that, though, you better see one of us first, and then we can tell you. And some nails are normal, and some are fungal. Some have a different shape to them, more of a club type of nail. There are certain things you can do. I mean, I do take liberties and cut the corners a bit, but I might go just 30 degrees, and a lot of us go at a 45-degree angle just to get that corner. And then what grows out later is an ingrown toenail. So straight across is the answer.
Yeah, my question is, I've got athlete's foot, so do I put the ointment first and then the lotion, or?
Athlete's foot, you want to use an antifungal, of course, and just use the straight antifungal. Don't need to put anything else on it.
Yeah, and a lot of this, I've also got a bad, what do you call, fungal infection on the toe.
Of the toenail? Yeah, a lot of patients present with that. It's called onychomycosis, and it's a condition that you can hardly control. I mean, either you're predisposed to it or you're not, genetically. I mean, we have an immune system that codes for fungus, for fighting fungus, the bacteria, viruses, and if you, given the right conditions, because the fungus is everywhere, it's like dust. And so why don't we all have that? Well, we're probably predisposed to it from the beginning. And so a shoe, dark, moist environment is perfect for fungus to grow. Usually athlete's foot, you don't have to be an athlete to have athlete's foot, but you can get that, and then it's a chronic condition, hard to cure. But then from there it goes to the toenails. And then if you treat the nails and you don't treat the shoe, you just reinfect yourself. So the shoe must be powdered with an antifungal powder. Don't wear the same pair 2 days in a row. Let them air out. They have to breathe. Okay? So that's what I would suggest. If your feet perspire excessively, then there's a treatment for that too. Yeah. The treatment's worse than it's 10% formaldehyde. And formaldehyde kind of smells. But it's 10%, so it's not too bad. Underarm deodorant works. That contains aluminum chloride, and that's still the chemical, the same underarm deodorant that we use. You roll that on the bottom of your feet, and first thing in the morning, and that will prevent perspiration, excessive perspiration. Yes, sir.
Yeah, I have a question about, do you know any store about shoes, to buy good shoes for like sneakers, doing exercising, playing soccer and all those?
Well, yes, there are reputable shoe stores. You don't have to get to a shoe store that specializes in running and jogging and climbing and hiking and all that. What you have, that handout you have there will give you the information you need. The shoe must have, could you possibly bring me that shoe back there, both those shoes? The shoe must have a rigid heel counter. That's the rear part of the shoe. When you squeeze it, it shouldn't collapse. It should have some structural stability to it. That's number one. The midsole should be reinforced. That is, when you bend the shoe, it should not bend in the middle. Thank you. So here's the heel counter. That's the back of the shoe. Squeeze that, and that should resist collapse. It shouldn't collapse. When you bend the shoe, you notice it bends where your foot naturally bends, at the big toe joint, not in the middle. If the shoe's brand new and you can fold it in half, that's not a good sign. And finally, if you twist the shoe, and that's on the paper as well, if you twist it, it resists torque. It's hard to twist. If you just remember those three things, and when you purchase a shoe, you'll more likely get a good shoe. You don't have to go to a high-end shoe store. You can go to Big Five Sporting Goods. The problem there is you may get help and you may not. You're there and you're waiting. But if you have this knowledge now, you'll pick a good shoe. All right, purchase your shoe in the morning, or rather afternoon, not morning. Just the opposite, when your feet have had a chance to swell. Have them measure both feet, if they'll do that for you. Tell them your foot doctor told them to measure both feet, because you may have one side may be longer, the other may be wider. So you want to buy the widest of the two and the longest of the two. Okay, and we can always do something to make the long shoe fit the short foot and so forth. So that's the important thing. Finally, if it has a removable insole, that is, you can take the insole out like that, then there's plenty of room in there for an orthotic, and that's an arch support that's made to your foot for biomechanical problems that are contributing to your hammer toes, your bunions, your corns, your calluses. Things that most people come in for. My feet are killing me. I've got this big callus on the bottom, or I have this corn on the top or between the toes. And a shoe like this has ample room, plenty of depth, that you can get a custom support in there to change your mechanics and hopefully prevent or at least control your pain, your symptoms. When that fails and we've tried everything else, then surgery on an individual basis is performed, meaning nobody wants surgery, but if it's going to make you better and allow you to live a healthier life and continue walking, because we have to do that, then if your doctor and I consult and you're okay as far as he's concerned, we can do it under a local anesthetic, which is much safer than a general anesthetic. So there are things that we do in the operating room that can be very beneficial to the diabetic as well as to the non-diabetic. Obviously, we work with other doctors, your cardiologists and your vascular surgeons, because if your circulation is compromised, we need to fix that first. There's no way that I'm going to operate on someone if their circulation is compromised and they're not going to heal. So we have that relationship here at Washington Hospital. So it's a team effort. And the bottom line here is to keep you on your toes, no pun intended. But you need to walk. We all do, as a matter of fact. Okay, you need to stay healthy. The part of your diabetic care is exercise. 6 days a week, maybe? 5, at least 5. But you need to walk at least half an hour a day. If you can't walk because your feet hurt, please call one of the podiatrists in the area, and maybe we can help you. Yes?
For the feet, during the winter, my feet always feel cold, especially at night. If I don't soak it in hot water or a heat pad before I go to sleep, my feet won't get warm till the morning.
Yeah, and that happens with non-diabetics as well. And it's really a difficult problem because, I mean, with a non-diabetic, you'll know if it's too hot. But what about the diabetic? You might be using too hot water, and if it's too hot. So if anything, lukewarm would be fine. You could use that. There are certain topicals, vasodilators that you can put on your feet, but you know, you should go to your doctor first before using any of that stuff. Heating pad, sometimes medium, not high, to your lower back, even though it's your feet that are cold, sometimes will help. Okay, but always on medium, yeah. And I wouldn't soak in hot water. I would check the water with the back of my hand, you know, to make sure it's not that hot. That's important.
Otherwise, I have something, you know, looks like mosquito on my toes. Inside the back, I feel itch. I know that is the cold that make the circulation not good, and then become that kind of the spot.
Is the spot? Where is the spot?
On the feet, toes, and because of the blood circulation not good, that's why I got that. It's itch when it get warm.
Okay, well then, if it's itching, I would like to look at it because first thing comes to mind is athlete's foot, tinea pedis, or athlete's foot. That would be the first thing, and then of course you can treat that. There's a topical for that. Over the counter, Lamisil is fine. You can get that over the counter. It's a topical, if that's what it is. It's hard to tell without actually looking at it. So it wouldn't be fair to tell you necessarily unless I looked at your feet first.
Only in the winter.
Oh, only in the winter?
Yeah.
Okay.
So after warm and the blood circulation good, and those will gone.
Yes. There's more circulation on the periphery up above where the skin is, and your own natural defenses can take care of it usually. But in the wintertime, you want to preserve heat so the circulation is diverted to the internal organs, right? So you don't perspire in the wintertime. But in the summertime, you want to get rid of the heat, and you got plenty of circulation up here. And so it may be that you're able to fight whatever that is. Your own body can take care of it because there's plenty of, just like the video suggested, nutrients by way of the circulation, and then also removing the byproducts of that is important in all of us. And when the circulation isn't working properly, or due to conditions like this, You just don't get the volume of blood down there.
I've got a growth on my the back of my heel. It's like a bone sticking out. What would you do to help me with that? Because it's an irritation at
I was
times.
gonna
It
ask you-
doesn't really hurt,
It's
but it rubs against the back of the shoe, and I have like
Right.
a little hole in the back of my shoe.
Okay, well, we call that a pump bump. Women who wore pumps in the past, that pump would rub against the back of the heel and would create this little bony prominence over time, over lots of time. Usually it's a soft tissue inflammation before it becomes a bump. But avoiding pressure on that area is the first thing you would want to do. If you did that and you were still having a problem with it or it became worse, then that bump can be removed. And frequently we do that.
I've been thinking about that myself.
Yeah, especially if it keeps you from doing what you need to do, walking, exercising. Any activity that you enjoy that you can't do because of that nuisance, it can be fixed. It's either that or alter your shoe gear or even pad the back of the shoe. We can try that. We always try conservative care first. I mean, that's my philosophy. Try to get the patient better without surgery. If it doesn't work and they're just back there saying, we got to do something, then we'll get an x-ray.
So what would you do, like grind it down or something? On
Yes,
surgery?
it's
Okay.
yes.
What would you do for calluses? Like I've got some calluses between my right toe and my right foot and my left foot on the little toe between these two.
Between the toes.
Yeah.
Well, we had a patient the other day that responded very well to taping or strapping, and I do that just to evaluate the possibility of making an arch support for that individual that would control their mechanics. If there's tight grouping there and your foot's moving within the environment, the shoe, and it can only go so far, if you can control the amount of range of motion in that shoe of your foot, sometimes that goes away. That painful process goes away. The structural problem doesn't go away. It's still there. The bone on this toe touching the bone on this toe, and the end result's friction and a callus. Now, if that doesn't work, so we're making her a pair of, not this, but a special pair of orthotics. If that doesn't work, then you can have that prominence shaved down and the other side as well. And then there's nothing from within that's causing so when you have this tight grouping, you don't have that bony prominence anymore, and the corn goes away.
For over 20 years, I've fixed cracked heels with crazy glue with no effect, and it heals instant. Like you brought up duct tape, as
Yes.
you mentioned.
Yes, that's a good comment because crazy glue has been used in surgery. It's that particular
That's
chemical.
where I got the idea, and sometimes
Right,
I
for-
stick my
Right.
crowns that come off with crazy glue.
With that, for repairing a skin incision, for example, some surgeons have used that as opposed to the traditional stitching, right? And that's the first time I've heard that, though. For crowns? Wow, that's a new one to me. Yes, sir.
Question, I have the spur on my left heel.
Bottom or back? On the bottom of the heel or on the back of the heel?
In here.
Right, okay.
But I don't know, this is because the circulation not good, it's caused that one, and also does this related with the diabetes?
No, is it painful? Your spur, does it hurt?
It was, so I treated it. It's now
It's okay now?
it's already now. I put 3 of the shoes insert
Yes. Okay, good.
and standing on the mats while I'm working.
Right.
So try to get more rest.
Good.
But
Good. Yeah. No. It was painful. A bone spur. There are two types: posterior heel bone spur, which is in the back of the heel where the Achilles tendon attaches, as you mentioned earlier, and there's an inferior bone spur on the bottom, which is what you have. And the spur is not the problem. The problem is the muscle that attaches right where the spur is, and that's called the fascia. The plantar, meaning bottom, plantar fascia, and that becomes irritated at its attachment, which is right near the spur. So the spur is a sign that over the years there's been a lot of stress on that heel at that point, and your body knows to toughen that part up so it won't break down. So it does so by laying more calcium, if you will. Instead of a spur, on the x-ray it looks like a sharp pointy thing. It's actually a shelf of bone that goes from left to right on the bottom of your heel. It's not one piece of bone, it's a shelf. But when you take an x-ray this way, it looks like a pointy thing. Yes, it does. So we have found that in the past, doctors would take the spur off, and while they were there, they would cut the plantar fascia to relieve the pain. This is someone who has tried physical therapy, they've tried injections, they've tried arch supports, stretching, night splints, and it still hurts. And so the last thing to offer is surgery. Now, when the surgeries were done initially, doctors would cut just the muscle, the plantar fascia, and leave the spur behind. And of course, they would get better, but the patient would say, you didn't do anything, the spur is still there when they take the x-ray, the post-op x-ray. So by just removing the spur, the pain doesn't go away. By cutting the muscle or the fascia, the pain goes away. But traditionally, when you remove the spur, it's a rather rough way of doing it, and you create little micro fractures as you're taking the spur off, or you're shaving it off. So you create little tiny, tiny fractures there, and that's why it hurts. That's why it takes months to get better, actually to feel better. So if you don't take the spur off and you just cut the muscle, they do better. Now, since then, there have been other operations where if this is a chronic problem, you've had it for a long time, 6 months to a year, it becomes a chronic issue now. And it's not an inflammatory process as much as it is a degenerative process, meaning you've got an acute wound that turned into a chronic wound. And a chronic wound won't do well with injections of cortisone or anti-inflammatories like Motrin. What's done now is sometimes they'll perforate the plantar fascia to create bleeding, and you now have created a chronic wound back to an acute wound, fresh wound, a fresh plantar fasciitis, we call it. Itis meaning inflammation. Okay? And sometimes that makes the pain go away without cutting it. And there have been a whole bunch of other types of surgeries, like trephining the heel, where they drilled holes in the calcaneus, in the heel bone. It's called the calcaneus. And that didn't prove to be too useful, at least not in my hands. And there are other modalities that are being used that are non-surgical, where you've come full circle, nothing helps. Well, you don't quite want surgery, let's try this other new thing. And that's something that's been using sound waves, which sometimes in my practice has not been as useful. I've talked to other doctors that feel like it's about 50%. So that's worth trying. But essentially, the surgery's left as the last resort. So the fact that yours got better with mechanical control, you know, we mentioned that earlier. The film didn't talk about biomechanical control of the way your foot works. If you control the mechanics of your foot, the muscle doesn't have to work so hard. So if it doesn't have to pull so hard, sometimes the pain goes away. So you need to wear those arch supports. Yes, the question is, will Dr. Scholl's drops, topicals, help calluses? They do help calluses, but again, the back of the bottle will say, if you're a diabetic, consult with your doctor first, because it's an acid and it can do damage to your skin, especially if you have any degree of neuropathy. Does everybody know what neuropathy is? Have you all heard the word before? Okay. Okay, obviously we want to prevent neuropathy from occurring, right? It's a loss of sensation. Yes, it's a loss of sensation because the glycemic state of high blood sugar affects the function of the nerve. In other words, if you're not controlling your diabetes over a period of time, it's toxic to the nerves, basically, sugar is. And so if you can, that's the key here, is prevention. So if you can be a good diabetic, control your sugar, watch your diet, get your exercise, and see your doctor frequently, then often you can prevent the condition. There are other types of neuropathy that occur. The result's the same. But alcoholics can develop that even if they were alcoholics many, many, many years ago and they quit. The damage is done, and they can get anything from burning pain, more commonly burning foot pain on the bottom of the foot, hypersensitivity, loss of sensation eventually. B12 deficiency, I think iron deficiency anemia. Hypothyroidism can do that. But these symptoms usually start out as hypersensitivity and eventually become total loss of sensation or numbness. So diabetes, pernicious anemia, hypothyroidism, alcoholism, and something called heavy metal poisoning or exposure to certain metals throughout your lifetime. So if you worked at Kaiser Steel in Fontana and your whole life, you might suffer the effects of exposure. And not picking on them, but I'm just saying it depends on your what you've done most of your life, where you've been exposed, what the environment is, and that sort of thing. So neuropathy can be caused by other things too, but it's the sugar that causes the damage to the nerves. And over time, we know that diabetics also, if you have the condition, it can accelerate the atherosclerosis or the hardening of the arteries, right? That means that the lumen of the artery gets smaller much quicker over time than if you were just hypertensive or you were a smoker. So if you have hypertension, you have diabetes, and you have lipids, high cholesterol, then that process is accelerated. Now, exercise will lower all of that. It will lower your blood pressure. Exercise will lower your lipids, hopefully enough that you get your LDLs down and your HDLs up. But you have to be consistent. You have to do it often, and also lower your blood pressure. So all it is a pair of athletic shoes, and you have to get out there and walk. And that's the best medicine, because you're not taking a pill. You're just doing something that's good, that all of us should be doing. And all of us should be following the diabetic diet, but we don't. So I think if you just do the best you can. That's all anybody can ask. And you need to know why you need to do this, to prevent that condition, the neuropathic condition, because those are the individuals that don't feel pain. They end up in trouble. They step on something, they didn't know it because it didn't hurt. They end up in the emergency room and then hospitalized for IV antibiotic therapy, wound care, all the resources. Everybody's there, the vascular surgeon, the podiatrist, sometimes the orthopedist, also the wound care people, and the vascular technologist that checks your circulation. So there's a lot of effort that goes in there to saving a limb, and sometimes we're successful and sometimes we're not.
Doctor, I want to know if I have bruises or swollen spot from my foot, do I do any differently than normal people?
Bruises and swollen spots, did you say?
A swollen spot from injury.
Oh.
On my foot. So do I take care of it differently, or just?
Well, is this a recent onset?
Yeah, I fell down.
Okay.
So my ankle swells up, and then I have bruises.
Which would
no
be
bleeding though.
Typical of anybody that would either twist an ankle or fall, unless you're on some sort of blood thinner. That if you twisted your ankle and it hurt and it turned black and blue and it was swollen and all that, there may be more damage than just a mild sprain or strain.
So just take care of it just like any other normal people.
I would do that. If it didn't resolve within a period of time, short period of time, then I would find out. I would consult your doctor, your physician, personal physician first. Okay. Are you in any pain at this point?
No, I have no pain. It's just swollen
it's
and
swollen.
With the bruises, and so yeah. I don't know if I should use the heating pad or hot water.
Well, at this point, I wouldn't use the heating pad. Not at this point. I mean, ice is okay if you just did it recently, but for the most part, anti-inflammatories, they'll increase the bleeding if you take too much aspirin, for example, or Motrin. How far out are you from the injury?
Well, it's minor.
Okay, was it a week ago or 2 weeks ago?
3 days.
Oh, 3 days ago. So, yeah, ice is good. Ice. An ice pack. Yeah. Take a bag of frozen peas, 2 bags, and keep one in the freezer, keep both in the freezer, and then use one on your ankle, okay? And then I would do that a couple times a day. All right, and if you're not any better certainly within 7 to 10 days, and particularly if you're having some issues with walking, I'm assuming, and that's not a good thing to assume, that you're not neuropathic, that you don't have neuropathy, that you can feel everything.
Yeah.
Yeah. So you can then it's what I'm telling you is probably a good thing then. Okay. But certainly if you're not any better within 10 days, let us know. It's going to turn color. It's going to turn black, blue, gray, or green, yellow, and then it will go away. So that takes time. That takes time.
Yeah, my question is, in my foot on the bottom, I
Yes.
got dead tissue. Then the other side, kind of when I walk, like a wounded, then I can't walk. It hurts a lot. Then
You do have an open wound?
No.
No open wound.
No
but
open wound.
It's like
that
dead.
one. It go and it comes.
Okay.
It depends. But the other, the dead tissue, is over there for good, for a long time now.
Okay.
How do I rid of those? What can I do?
Well, there are a number of agents that you can put on there. If there are no open wounds, you can use one of the items we spoke about earlier, like Uracin. Yeah, there's something called Uracin 20% urea, caramel cream or urea. And there are different names for that product. But that takes, if it's on the bottom of the foot, that helps to get rid of all the dead tissue. Once the dead tissue is gone, then you don't use it anymore. Okay? Then you switch to something like Cetaphil. Any Cetaphil, Lubriderm, any of the regular hand lotions with lanolin. Any of them are fine. But you need to get rid of the dead tissue first. And you don't want to use a pumice stone. You might get too aggressive, or one of those egg things, because it's like a cheese grater. You might go too far, too deep. So the chemical is usually okay, that particular one.
Okay. Thank you, Dr. Alaniz,
You're
very
welcome.
much for your very informative presentation.
You're welcome. Thank you.